Today, we're talking about something really important and emotional: what happens in the last stages of heart failure. It's a topic many people avoid, but understanding it can truly help you prepare and support your loved ones better. Over 6 million people in the US alone are currently living with heart failure. And while treatments can slow it down, it's a progressive condition, one that unfortunately leads to death in many cases. In this video, I'll walk you through the 13 major signs and symptoms that someone is reaching the final phase of heart failure, and what that might mean for their life expectancy. Stick around till the end. I'll also share a general timeline for how long a person might live once they've reached this late stage. What exactly is heart failure? First, let's break down what heart failure really means. Heart failure doesn't mean the heart has stopped, it means it's getting weaker over time. As it loses strength, the heart struggles to pump enough blood to the rest of the body. That poor circulation affects organs, muscles, and everything in between. In the early stages, the heart and body try to adapt. The heart might enlarge, beat faster, or change shape to keep up. The blood vessels also narrow to help reroute blood to key organs. But eventually, those workarounds stop working. The blood flow simply can't keep up, and symptoms begin to show. 13 end-of-life signs in heart failure. Let's go over the key signs that suggest someone is in the final stage of heart failure. 1. Struggling to breathe. Even while resting, the person might feel short of breath. This happens when fluid builds up in the lungs because the heart can't keep up with pumping efficiently. 2. Feeling anxious or panicked. Shortness of breath can trigger feelings of fear or panic, and anxiety can make breathing even harder, creating a tough cycle. 3. Persistent coughing. That same fluid in the lungs can lead to a chronic cough. It's often worse at night or when lying down. The person might cough up white or pinkish mucus. 4. Wheezing. A whistling or crackling sound when breathing could also be present, again due to fluid congestion in the lungs. 5. Swelling or puffiness. When the heart can't pump well, fluids collect in other parts of the body. You might notice swelling in the legs, feet, hands, abdomen, or even neck veins. 6. Sleeping more than usual. As the body shuts down, the person may start to sleep longer and more often. Over time, they might be asleep nearly all day. 7. Extreme weakness. They may struggle to move around, feed themselves, or even sit up in bed. Eventually, they may need full-time help with basic tasks. 8. Loss of appetite. Food becomes less important. Their hunger fades, and they may stop eating altogether. This is a natural part of the body slowing down. 9. Nausea or bloated feeling. As digestion slows, they might feel queasy or bloated, especially if there's swelling in the belly. 10. Changes in bathroom habits. You might notice they're peeing more at night or experiencing incontinence. This could be from medications, like water pills, or just overall fatigue. 11. Rapid heartbeat. The heart might race as it tries to compensate for its declining function. Some people feel like their heart is fluttering or pounding. 12. Chest discomfort. Chest pain or pressure can occur, both with movement and while resting. 13. Confusion and memory issues. As the brain gets less oxygen and blood, the person may seem confused, forgetful, or disconnected from their surroundings. Toxins building up in the bloodstream can also contribute. If your loved one is showing most of these signs, it may be time to speak with their doctor about palliative care options. This can help manage symptoms and provide comfort-focused care in the final months of life. Remember, not every person with end-stage heart failure will experience every one of these symptoms, and the severity can vary day by day. How much time is left? So, what does this mean in terms of time? In general, the average life expectancy after a diagnosis of end-stage heart failure is less than a year, and it can be as short as just weeks to a few months, especially if the person is showing many of the symptoms we talked about. Of course, every situation is unique. Things like coexisting conditions, like kidney disease or cancer, how well symptoms are being managed, or how much the person is eating or moving around, all of these affect the timeline. Final thoughts. Watching a loved one go through heart failure is incredibly difficult. But knowing what to expect, and recognizing these signs, can give you the chance to offer support, ask the right questions, and create as much peace and comfort as possible during this time. If you found this video helpful, please don't forget to like and subscribe. It truly helps more families find this kind of information when they need it most. Feel free to leave your questions or share your own experience in the comments. I always try to read and respond when I can. Thanks so much for watching.